I think the problem is, especially when you go online and you try to figure out what's causing your symptom, is you start clicking on everything, and before you know it, you're clicking on a symptom or a diagnosis that has nothing to do with your symptom, and then now you're somehow went from coughing to you have a clot in your leg, and maybe you're about to have a heart attack, and you're not even sure how you got there.
I'm Dr. Chris Kelly. I'm a cardiology fellow in New York City.
Hi, I'm Dr. Marc Eisenberg. I'm a cardiologist in New York City.
We're both cardiologists, and we're the authors of Am I Dying? It's a new book that helps people understand their symptoms and know whether they need to worry about them or just chill out. Obviously, not all chest pain is a heart attack. If you've been coughing a lot and whenever you take a deep breath, you feel a sharp pain in your chest, that's probably a pulled muscle from all the coughing. It's also possible you could have something like pneumonia if you also have fevers and chills and you're just not feeling well. Another thing is if you have chest pain after you eat a big meal or after you lie down, it's probably more likely to be acid reflux, maybe a stomach ulcer. And that's not something you should ignore. You should make an appointment to see your doctor about it, but you don't need to rush to the emergency room immediately. Your life's not likely to be in danger. If you have a recurring headache, but it's on one side of your head and it's throbbing, and when you have it, you feel sick to your stomach, and sometimes before or during the headache, you see maybe flashing lights or visual changes, that is a slam dunk for a migraine. And you should see a doctor because those are very treatable. There's a lot of therapies that can make those much less painful or even gone altogether. We have what's called a thunderclap headache, meaning it comes on within minutes, it reaches its peak intensity almost right away. That's a headache that needs to be checked out very urgently. And likewise, if you have a headache and it's associated with weakness or numbness or vision loss, that obviously needs to be checked out right away.
You need to know what else is going on and what are the other symptoms happening at the same time. You need to know where in the abdomen it hurts, if there are other associated symptoms like nausea and vomiting or diarrhea or pain, like typically the one everyone most fears is appendicitis, which is a lot of times pain with nausea and vomiting that starts in the middle and all of a sudden shoots to the sort of lower right. Other common causes of significant abdominal pain or pain that is in the lower left, and that could be something called diverticulitis, which is when parts of the colon sort of get infected, and that needs to get seen right away to get antibiotics.
When you see a doctor, start with the symptoms and with your story rather than starting with what you think is the explanation. Because number one, you don't want to bias the doctor into thinking a certain way. You want them to have an open mind when they see you. And number two, the doctor is ultimately going to want to know what your symptoms are and reach his or her own conclusions anyway. So I think it's fine to do research, but when you see somebody, you'll probably just want to describe your symptoms and see what they think. It's normal throughout the course of your life to feel aches and pains in different parts of your body, to experience changes and new symptoms. Most of the time, it's not something that's dangerous, but as a human being, you owe it to yourself to understand the basics of how your body works and when you should be worried about something, when you should spend your hard-earned money to see a doctor or go to the emergency room. And we hope that our book will help people get that kind of education about themselves.